In this video, I'm going to give my top 3 exercises for people over 60 who are suffering from sciatic symptoms or radiating leg pain. Now, the reason I can be so confident that these exercises will probably help you is because your sciatic symptoms are probably related to one specific thing: stiffness. Now, that might sound really simple, but what tends to happen as we get older is that the intravertebral discs tend to reduce in their disc height. They lose their water content, and so therefore everything gets a little bit more compressed, and so we have a susceptibility to stiffness. And so what I'm talking about here is segmental stiffness. And so if we get a stiffness between each individual segment, then the muscles can adapt as well. The muscles can get a little bit stiff and tight and restricted. Now, with stiffness, there's a bit of a giveaway of one direction that tends to get more difficult. So when people lean backwards, we should have a nice curve of the back. Now, when we have segmental stiffness, then there can often be a real restriction. People feel more comfortable when they bend forwards, but when they stand up or try to lean back, it's a bit uncomfortable, or it just won't go. This, for me, is a leading cause of sciatic symptoms in the over 60s, that you've developed a susceptibility to stiffness and effectively given into it without really realizing it. Good news, you can do something about it. You can mobilize those joints, you can improve the situation. Yes, we won't change the structure. The discs are still going to have lost their height, and there will be a susceptibility to stiffness developing. However, if we mobilize it, then movement breeds more movement. It can actually help to loosen off soft tissue tightness and actually lubricate joints and improve the mobility. We just have to work a little bit harder at it. And the exercises I'm about to show you are for just this. We can increase that flexibility by doing movements which help to segmentally mobilize and then improve your symptoms. So have a go. They may work for you, they may not, but in the vast majority of cases, they will improve things. And if the golden rule, of course, is that do not do an exercise that increases your leg symptoms. So let's take a little look at the exercises. It's 3 simple exercises with a few variations. Now, for this exercise, I've got down on the floor. You don't have to get down on the floor on a mat if it's a struggle for you. You can do these exercises lying on a bed. But what we're going to do is lie down on our backs with our knees bent. And very simply, what you're going to do is roll the knees over to one side and roll them to the other. We are not holding the stretch. We're pausing at each extreme a short period just to keep things moving from side to side. Now, we're trying to keep our shoulders down. We're letting our pelvis lift up and roll over from side to side. And we're going to do 10 rolls to each side. Now, what this has the effect of doing is mobilizing gently under no load or minimal load our lower back from side to side. So it helps to mobilize those segments of our back that need to be stretched. And this is a great way of doing it. Now, if you struggle to lie down at all because you're in too much discomfort, you can also do this sitting on a chair. So on a chair, we sit down, we fold our arms, and we rotate the body from side to side. Now, this isn't as good as lying down, but it's better than nothing. And so we roll from side to side, stretching as far as we can. If you're quite a mobile person, you could actually grab an arm of the chair and just pull yourself round for that little bit of extra stretch to each side. But we're doing it again 10 times to each side, and it will have the effect of causing some mobility around that lower back. The reason why it's not quite as good as lying down is because, of course, there is a little bit of load going through the back in the sitting position, whereas the lying position is that we do have minimal load. However, better than nothing, so that's a variation that could work for you. Now, for the next exercise, it's actually a stretch. So we're going to stretch the outer part of our hip, which is often really tight and associated with lower back stiffness as well. So it's another great mobilization technique, and it's going to help to open up those structures which are really stiff. So we lie down on our backs, And what we're going to do is cross one leg over the other. If we're able to do this, grab your knee and pull it across to the opposite shoulder and hold for 10 seconds. And after we've done our 10-second hold, we will then switch to the other side. So we will cross the leg over and pull it towards the opposite shoulder, and we should feel the stretch on the side. Now, if you feel lots of groin pain when you do this, then just be very careful because that can pinch the groin. We want to feel it on the outer side of the hip. That's where we want to feel the stretch. And we're going to hold it for 10 seconds. And we're going to do it 3 times, alternating from side to side. Now, again, if you're struggling to lie down to do this, the variation can also be done in sitting. So the variation in sitting is that we're going to just cross one leg over the other and give it a little bit of a pull towards the opposite shoulder. Again, we should be feeling it around here and not in the groin. If you're feeling it in the groin, then your hip is a bit irritated and it's best to not do this exercise. Instead, you can actually just pull it up directly without the pull across and just pull it up directly towards your chest from the sitting position. And of course, we're alternating from side to side, holding for 10 seconds, repeating 10 times on each side. And the final exercise is a very simple exercise, a sit to stand exercise with a little bit of a twist. If you struggle with knee pain at all, or you find it difficult to get up out of a chair, you could try this by actually just raising the height of the chair if you can, or putting a couple of cushions on it so that you start from a higher position, and that will take some of the pressure off the knees. But if you're able to do a sit to stand, it's actually a really good exercise for strengthening your legs as well as mobilizing your back. So let's take a look at what you do. So we're sitting on a chair and I've deliberately put the camera sideways onto where we are going to raise up and down from, because I want you to see the little twist that you're going to do at the end, which is going to help to mobilize the back. So very simply, we're going to sit to stand. Now, if you can do this without using your hands, that's ideal. But if you do need to use your hands just to assist you to lift up, that's absolutely fine. But if we stand up, and what we're going to do once we're up is a little bit of a tilt backwards and then back to the middle and then sit back down again. So we repeat that. We lift up, a little bit of a tilt backwards, and then we sit back down. We're up, tilt backwards, and we sit back down. And you notice how I'm doing it very, very slowly with control. We don't want to do it jerky or too fast. We want to do it slowly because our back is stiff and we need to mobilize those segments, and that takes a little bit of time and an adaptation to take place. So very simple, 10 repetitions of the sit to stand exercise, and that's a great way of mobilizing into that stiffness and mobilizing those segments that can help to relieve those symptoms. So there you go, 3 simple but really effective exercises for problems that often affect people in their 60s and over. I do hope that that's helpful. If you're looking for other ways to get comfortable if you're suffering from sciatica type symptoms, then try this video, which is 5 positions which can help you to relieve your leg symptoms.